School time, John.
Yeah, and you know what, Randy? The CDC preaching to the choir. Last week, it published a report stating that many schools start the day too early for teenagers to get the sleep they need. Hello. Yeah, Dr. Ochild, he's been preaching that now for years. He joins us from the Clayton Sleep Clinic. Well, yeah. I mean, they know what you've known for a long time.
Well, it's been out there, John, and I appreciate your interest in letting us talk about this subject. It's important.
Well, teenagers aren't like us.
They're not. As their clocks are moving, as they hit adolescence, their clocks start to move and they want to stay up later and sleep later. It's biological.
Their brains want to stay up until like 11 o'clock at night.
Exactly. And they don't have control over that. It's a developmental issue. So part of it is we need to adapt our school times to their biology.
We did some digging, and you did as well. We're not finding that in St. Louis. Most schools begin before 8:30.
They do, and actually that's nationally. So what we want to do is we want to be a resource for the educators in St. Louis, for the school districts, and encourage them to look at the biological data and look at the improvements, the positive things that can happen if they move start times back. And some of those positive things do include, there is very good data showing improvement in both performance academically, test scores, grades in class, behavior changes, and safety changes. Youngsters who are sleep deprived, this is a group that's new to driving. So
right.
They have increased rates of auto accidents, so this makes driving safer for them if we get them more sleep. Their behavior and their performance is improved.
I'm looking for this. The CDC and the American Academy of Pediatrics both suggest what you say, and the CDC goes on to call it a substantial public health concern.
It is. It's a public health concern at several levels. It increases risks for these youngsters to overeat, for obesity, increased blood pressure, and interestingly, chronic sleep-deprived people, including youngsters, they tend to be more irritable and actually more potential for violence. So it helps with behavioral moderation as well.
So the recommendation, teenagers ages 14 to 17, 8 to 10 hours of sleep each night, okay? For adolescents, 6 to 13, the range is 9 to 11 hours a night.
This is some of the peak times of sleep and the entire developmental period of our lives is during that adolescent period. It contributes to both brain development, and one of the things, and we've all been through this through our lives, is if you get a good night's sleep, we tend to do better on examinations and so forth. Memory consolidation, the ability to actually memorize or to remember the things we're learning, are imprinted on our brains by getting a good night's sleep.
So Dr. Ochild is now backed by the CDC with the same recommendation that we've been talking about, I don't know, for 5 years now, that I can remember. And so it'll be up to the PTAs and the school administration to make the change. Do you think you're going to see that?
Well, we're hopeful.
Okay.
We're out there and we want to make sure that all those organizations and the school districts know that we want to be here and be a resource for them.
And the teenagers are going, more sleep. At least that's the perception. It's
yes.
more. Dr. Ochild, thanks for coming
John.
in. We appreciate it.
Appreciate it.
Randy?
All right, some good information. Thank you.